Imagine the scene: your beloved grandparent, their hands now bearing the delicate map of a life well lived, lies in a stark, sterile hospital bed. Their eyes, once sparkling with stories, now hold a flicker of confusion, a touch of disorientation. And they are utterly, heartbreakingly alone. A cold shiver traces its way down your spine, a primal instinct screaming at the vulnerability of this image, doesn't it? We entrust hospitals with the sacred duty of healing, of mending what is broken. Yet, for our senior citizens, those who have weathered so many storms of life, these very institutions can inadvertently transform into a treacherous landscape riddled with unseen dangers when they must navigate them without the unwavering presence of a familiar face, the steadfast voice of a strong advocate. The absence of this crucial support doesn't just add to their emotional burden, it can significantly amplify the very real and critical risks they face. Let us now carefully peel back the layers and delve deeper into 10 profound vulnerabilities that starkly underscore the paramount importance of ensuring our elderly loved ones have dedicated support and a constant presence during their often daunting journey through a hospital stay. 1. The silent stumble. Amplified risk of falls. Hospitals, with their maze of equipment, slick floors, and hurried staff, present a significant fall hazard for seniors. Pre-existing mobility issues, the grogginess from new medications, or even just disorientation in an unfamiliar environment can lead to a misstep. Without someone present to offer a steadying hand, remind them to call for assistance, or simply keep a watchful eye, the likelihood of a fall, and the potential for serious injury, dramatically increases. A fall can lead to fractures, prolonged hospital stays, and a decline in overall well-being. 2. A cocktail of confusion, heightened danger of medication errors. The intricate dance of prescriptions, dosages, and timings in a hospital setting can be overwhelming, even for the most lucid individuals. For seniors managing multiple medications, the risk of errors, wrong drugs, incorrect doses, missed administration, skyrockets when they are alone. They might not recognize a discrepancy, be too intimidated to question a nurse, or lack the cognitive capacity to manage their medication schedule independently. The consequences of a medication error can range from unpleasant side effects to life-threatening complications. 3. Invisible invaders. Increased susceptibility to hospital-acquired infections. Age often brings a decline in immune function, making older adults more vulnerable to the opportunistic bacteria and viruses lurking in hospitals. Simple acts of hand hygiene can be challenging for some seniors, and without an advocate to ensure proper hygiene practices are followed or to promptly report early signs of infection like fever or unusual pain, an infection can take hold. These infections can significantly prolong hospitalization, increase morbidity, and even lead to mortality. 4. The withering away. The threat of dehydration and malnutrition. Maintaining adequate nutrition and hydration is crucial for recovery, yet it can be a significant challenge for hospitalized seniors who are alone. They might struggle to open food containers, have difficulty feeding themselves due to physical limitations, forget to drink, or simply lack the appetite in an unfamiliar and potentially stressful environment. Without someone to encourage them to eat and drink, assist with meals, and monitor their intake, they can quickly become dehydrated and malnourished, hindering their healing process and weakening their resilience. 5. Whispers unheard. The danger of delayed or missed care. In the hustle and bustle of a busy hospital ward, subtle but significant changes in a senior's condition can easily go unnoticed, especially if there's no one present to advocate on their behalf. An elderly patient might experience increasing pain, new or worsening symptoms, or a decline in their mental status but be unable to effectively communicate these changes to the medical staff. This delay in reporting can lead to a delay in diagnosis and treatment, potentially allowing a minor issue to escalate into a serious complication. 6. Lost in translation. Navigating communication barriers alone. Effective communication between patients and medical staff is paramount for quality care. However, many seniors face communication hurdles due to hearing loss, vision impairment, cognitive decline, or language barriers. Without a family member or advocate present to bridge these gaps, they may misunderstand instructions, fail to articulate their needs or concerns, or feel overwhelmed and unheard. This breakdown in communication can lead to frustration, anxiety, and suboptimal care. 7. The crushing weight. Emotional distress and isolation. Hospitalization can be an isolating and emotionally taxing experience at any age, but for seniors, who are often grappling with other age-related challenges, being alone can amplify these feelings. The unfamiliar surroundings, the lack of routine, and the separation from loved ones can lead to increased anxiety, depression, and a sense of helplessness. Social isolation has been linked to slower recovery rates and a higher risk of complications in older adults. 8. The shadow of neglect. Increased vulnerability in the absence of oversight. While most healthcare professionals are dedicated and caring, the absence of a watchful advocate can unfortunately create an environment where subtle or even overt neglect can occur. This might manifest as delayed responses to call bells, inadequate attention to personal hygiene, infrequent repositioning leading to pressure ulcers, or a general lack of engagement with the patient's needs. Without someone to monitor and advocate, these instances of neglect can go unnoticed and unaddressed. 9. A cascade of confusion, difficulty understanding discharge instructions. The flurry of information provided during discharge, medication schedules, follow-up appointments, warning signs to watch for, can be overwhelming for anyone, especially a senior citizen who is alone, possibly still feeling unwell, or experiencing cognitive fog. Without a family member or advocate present to listen, take notes, and ask clarifying questions, the senior may leave the hospital with a poor understanding of their post-discharge care plan, significantly increasing the risk of errors in self-care and hospital readmission. 10. Erosion of dignity and security, loss of personal belongings and respect. Being hospitalized and dependent on others for basic needs can already be a blow to a senior's sense of dignity. When they are alone and potentially vulnerable due to confusion or frailty, the risk of losing personal belongings or experiencing a lack of respect for their privacy and autonomy can increase. A familiar advocate can help ensure their personal items are safe and that their dignity is maintained throughout their hospital stay. In conclusion, while hospitals strive to provide excellent care, the vulnerabilities faced by senior citizens navigating this complex system alone are significant and multifaceted. Having a dedicated advocate present is not just a matter of comfort, it's a crucial safeguard that can dramatically improve their safety, well-being, and ultimately, their recovery.